Hello, everyone. We will get started here shortly. All right. Hello and welcome, everyone, to TMA's Ask the Expert. We are so excited to have you here with us today. And one moment, I am pulling up my script. All right. One moment. Looks like today I am going to have to do some editing, but that is quite right. I am Rachel Bromley's TMA Senior Manager of Patient Education Support and Advocacy. For those of you joining us for the first time, we're broadcasting from Columbia, Maryland, and we'd love to know where you're tuning in from. Everyone, please feel free to share your location in the chat box. It's always wonderful to see how far this community reaches. Make sure that your message is sent to everyone and not just the hosts and panelists. You can change who the message is going to by hitting the down arrow in the blue box at the bottom of your chat box. Since 1993, the Myositis Association, TMA, has been dedicated to improving the lives of those affected by myositis, fund innovative research, and increase myositis awareness and advocacy. We envision a world without myositis, and we work tirelessly to get closer to that goal every day. You've let us know that our Ask the Expert webinar series is one of the most valuable ways we engage with you. Each session features an expert from TMA's Medical Advisory Board or other distinguished members of the myositis medical community, and today is no exception. We encourage you to take full advantage of this opportunity, ask your questions in the Q&A box, engage in the chat with others, and remember that what you learned today can be shared with your care team, family, and friends to help educate others about myositis. Now, we're excited to dive into today's session, a special edition on physiatry. It's my pleasure to introduce our distinguished expert, Dr. Nicole Voet. Dr. Voet works as a rehabilitation physician and senior researcher at the Department for Neuromuscular Diseases and Rehabilitation Center, Clemendaal in the Netherlands, and at the Muscle Center in the Radboud University Medical Center in Nijmegen, the Netherlands. She is head of a project aiming to develop a national network for neuromuscular diseases. And Dr. Voet is acknowledged as an international expert on FSHD, fatigue, and training in neuromuscular disorders. She also currently serves on TMA's Medical Advisory Board. We are so fortunate to have her with us today. Thank you for being here with us. You are free to share your slides and get started.
You're welcome and happy to be here with people from all over the world. Macedonia, I saw Egypt. So nice to see you all here. And I also love the music. I will share my screen. Let's see. So I hope, is it visible now, Rachel?
Yes.
Yeah, okay. I will tell you in the next 20-25 minutes on my work as a physiatrist, physical and medical rehabilitation doctor in the Netherlands in myositis. And of course, there's enough time left for you to ask me questions. I will start with my take-home messages, because what is important on rehabilitation in myositis? First of all, when you are active, when you are exercising, start low and go slow. Then, regarding rehabilitation, one size doesn't fit all. The context is very important. Your partner, your job, your hobbies, what you like in daily life. And the last one, listen proactively to your body. So not only listen to your body, but also listen proactively to your body. And I will show you the research which is lying behind it. To make a little joke, what is myositis from a neurological perspective for my colleagues, the neurologists? Then you can see this figure, myositis from a medical perspective. It's a very difficult figure, I think. But also, is it maybe a unidimensional problem? And is this you with myositis? This is myositis from a rehabilitation perspective, but also from a patient perspective. You can see, of course, you all have muscle weakness, but regarding the burden of disease, there is more, because many patients experience fatigue, many patients experience pain, sleep disturbances are common, and with all that, physical inactivity is a big problem. And you can see these are multidimensional problems. As we take a look at the determinants of health, it's a big research all over the world, we can see that medical care is only in 11% the determinant of health. So we as doctors are not so important. 22% is determined by genetics and biology, 7% by the environment, 24% by social circumstances, so the context, and there it is, 36% by individual behavior. And that's my job. My job is to change dysfunctional cognition, dysfunctional behavior into helpful behavior, to help you to apply helpful behavior to lower the disease burden of myositis. I will show you some questions which I hear a lot in my consulting room. The first one is fatigue. How can I decrease my chronic fatigue? And yeah, unfortunately, fatigue in myositis is a big problem. I've taken a look into research, and on average, 30 to 90% of patients with myositis experience severe and chronic fatigue. And usually this is an indirect symptom. What is an indirect symptom? A direct symptom is, for example, the inflammation of muscles. That's myositis. But indirect symptoms are most of the time a result of a behavioral change. And that doesn't mean that it's your own fault, but it means that it's a consequence of the disease. And the helpful thing is that you can change your behavior, and with that lower your level of fatigue. And not so long ago, it was recognized and acknowledged as a problem when treating myositis. In the Netherlands, we build a model of perpetuating factors of experience fatigue, also in myositis. Or in other words, what makes that the acute fatigue becomes chronic fatigue and doesn't go away? You can see here that physical inactivity is very important. It leads to fatigue. Muscle weakness doesn't lead to fatigue directly, as I said before. It doesn't lead to fatigue directly. It's not a direct symptom of the disease, but it leads to fatigue by means of physical inactivity. And then pain and sleep disturbances are also very important factors in developing chronic fatigue. And with all this, it can lead to a lower level of social participation. I told you something about acute fatigue and chronic fatigue, but what's the difference? Chronic fatigue, we say, in the medical world, in research, it has a duration of at least 3 months. So if you experience fatigue for at least 3 months, then you have chronic fatigue. Another characteristic is that it doesn't always go away after rest. And you can imagine that is an unpleasant feeling. And the most important one, there is no relationship anymore between activities, rest, and your level of fatigue. I always ask my patient, can you explain your level of fatigue by means of the level of your activity? And if the patient says no, then there's a great risk that there is chronic fatigue. And as said before, it's a multidimensional problem. It's a biological, medical, psychological, social problem. Now, why are people with myositis prone to chronic fatigue? you can see here 3 different lines. You can see on the vertical axis the fatigue level and on the horizontal level the work of activity. You can see a blue line, for example, for top sporters with a low fatigability, or in other words, they build up fatigue during activity very, very limited. But you are the red line. You have a muscle disease with a very high fatigability. And as a consequence, your work of activity, the things you can do in your daily life are limited compared to top sporters or people without myositis. But we all only have 24 hours in a day. So as a consequence, the amount of rest is limited. And that's important. Please remember the amount of rest that you can have is limited. Because rest is as least as important as exercise when you want to decrease your level of fatigue. Because when you exercise or are active and you don't have enough rest, then your fatigue accumulates, and then your acute fatigue after exercise can become chronic fatigue. So please take enough rest during the day to prevent that you develop chronic fatigue. That about fatigue, then pain, because another important question is, how can I decrease my chronic pain? And just as fatigue, pain is very frequent in myositis patients. Also on average, 30 to 90% of patients with myositis experience severe and chronic pain, a big problem. Just as fatigue, it's also an indirect symptom, the result of compensation mechanisms. And what are compensation mechanisms? When you are moving or being active, then there is a certain muscle who is responsible for that movement, a primary muscle. For example, the quadriceps during cycling or the calf muscles during walking. And when these muscles are becoming fatigued, then other muscles help to be active. But that's a problem because these other muscles also have their own tasks and they are asked to be more active. And then you're at risk for pain in these compensating muscles. And I showed you fatigue, and happily we do now have helpful interventions, rehabilitation interventions for fatigue in myositis. For example, psychological interventions like acceptance and commitment therapy, cognitive behavioral therapy, and also exercise. But unfortunately, we do not have any helpful in research interventions for pain in myositis. I will show you the contrary. But don't panic, I also show you the solution. Just as acute and chronic fatigue, there is acute and chronic pain. Chronic pain, we say it's at least 3 months, and it doesn't always go away after rest. Acute pain can go away after rest. And just as in fatigue, there is no relationship between what you do and what you experience. So it's also very difficult to cope with a thing that there's no relationship anymore, and also a multidimensional problem. Don't ignore your pain, because when you experience pain, your body is talking to you. You can see here research in 3 groups of cysts. And to sum up the results, one group of cyclists receives fentanyl, a very, very effective painkiller. One group doesn't receive any medication, and one group received placebo. So they thought that they had a painkiller, but it was a placebo. You can see that the group who received fentanyl had a higher power output, cycled better in the beginning, but they had a decrease in power output in the end. The group with no medication had a more or less stable output with a little sprint in the end. And I think the most important thing is that the placebo group, who thought that they received medication but they didn't, also had a higher power output in the beginning and no decrease of power output in the end. So in other words, I say that's also the importance of psychological interventions. But this research also showed you that when you ignore your pain, you have a decrease in power output, a decrease in activity. It all only helps in the beginning and not in the end. So, okay, I want to do something about fatigue and pain. What can I do? How can I apply exercise? So could you give me advice on safe and effective exercise? I will give you some. I already told you that exercise also can have negative effects. Just like medication, there are side effects and there are adverse effects. Side effects is no problem in exercise. For example, can be muscle soreness, increased heart rate, shortness of breath, acute fatigue. And in patients with myositis, it can be more pronounced and longer and appear more quickly. But it's no problem when you take enough rest, because then it will go away. And these symptoms, they tell you that there is happening something in your body. So it's not a problem, at least when you take enough rest. But side effects can become adverse effects in myositis when you don't take enough rest. So when you don't take into account your recovery time. When there is an improper exercise selection, when your contextual factors need a lot of energy, for example, caring for your family, having a job, so you don't have enough time for rest, or when the exercise intensity is too high. A colleague from Stanford University showed that the recovery time, so the time needed to rest, is compromised and prolonged in neuromuscular diseases, also in patients with myositis. So in other words, when you are active, when you are exercising, you need a longer time of rest than people without myositis. Here you can see pictures of cyclists in the Tour de France. And I always say my patients are top sporters in daily life. They exercise, their daily life is already top sport for them. But these top sporters, these cyclists, they don't have to drive a car. They don't have to cook dinner. They don't have to clean their houses. And one of my patients said a couple of weeks before, I don't receive a gold medal, and they do. What I want to say with this is you are top sporters in daily life, and I ask you to exercise above that. So you have to be very careful with applying exercise in order to prevent overuse. I won't, because of the time, I will not show you this movie, but I will tell about it. This man wants to exercise, but we as doctors always think that people want to exercise to improve their aerobic capacity. But this man wants to exercise to lift up his grandchild to the Christmas tree. So therefore, he does his strengthening exercises in order to lift up his little child to the Christmas tree. And I always ask my patient, what is your aim for exercise? What is the aim of exercise? And then I take a look together with the patient, what is the proper exercise selection? What fits with your goal? Because then you receive your goal. Then there was a survey performed from the Amsterdam University Medical Center in the Netherlands among clinicians and patients regarding exercise. And it appeared that we always say exercise is safe, but still clinicians and patients are afraid of overuse, of overwork weakness, and clinicians always also say that they have a lack of knowledge about how to prescribe exercise, how to screen, how to dose, what is the intensity. And more than 70% of patients say that for them they are unable to perform the prescribed training level. And that of course leads to poor motivation and fatigue. And I will show you the reason. Because normally exercise is prescribed according to guidelines for healthy people. And the gold standard, so the way to know what is your aerobic capacity and to prescribe exercise, is a maximal cycling exercise test. And then you receive an outcome, for example, the aerobic capacity, but that's the sum of all these things, the sum of the muscle, the heart, and the lungs. And we know that, of course, in myositis, the problem is in the muscle. So therefore, we performed research in the Netherlands on muscle fatigue. So how can we measure muscle fatigue and with that prescribe exercise? And we did that with EMG measurements. And with EMG, you can measure the muscle activity. And what we saw in patients with myositis compared to healthy subjects is that the level of muscle fatigue was relatively high. So in other words, when both groups were cycling, there was already early in time a high level of muscle fatigue. And when we prescribe exercise according to guidelines for healthy people, then there is a high risk of muscle fatigue and overuse. So now we say cycle at, for example, 30% of your maximum, start low and go slow. And with that, we hope to prevent muscle fatigue, adverse effects, and also increase the level of the threshold for muscle fatigue. So you don't have a lot of muscle fatigue in your daily life too. But how can I decrease my muscle fatigue in daily life? When you experience fatigue, you can see that in your movement. On the left-hand side, you can see athletes during a competition. They all have the same technique. On the right-hand side, you can see two triathlon brothers. And you can see the one who experiencing the highest level of fatigue. It's the right-hand brother. Because you can see it in his body, in his movement, in his face. And therefore, we now perform measurements on muscle fatigue in which we use motion analysis. Motion analysis is also used to perform animation movies, for example. And we use reflective markers on the joints, and then we can make a kind of a stick figure of every person. And what do we see in these measurements? We can see the compensation mechanisms I mentioned before. We see your primary muscle, in this case, the quadriceps muscle for cycling becomes fatigued. And then other muscles, like the hamstring muscles, on the back side of the upper leg or the abductor, on the lateral side of the leg, they help the primary muscle, the quadriceps muscle. And we can see that in the movement because the movement changes. But then the compensatory muscles also experience muscle fatigue, and then we catch the muscle fatigue in EMG. We did that in cycling, and based on these measurements, we now prescribe individually exercise on an individual level to have the highest level of effect with the low level of muscle fatigue. And last summer, we performed measurements on walking, also in patients with myositis. And we measured with the kinematics, the motion analysis, and with the EMG. And we ask our patients on a scale from 0 to 10, what is your level of experience fatigue? So what do you feel regarding fatigue? And we measured for 10 to 30 minutes. It depends on the capacity of the patient. And we ask the patient, what do you experience on your fatigue? And we take a look at the beginning, in the middle, and in the end of the measurement, what happens. And what we saw, we measured 11 people. We saw that the objective muscle fatigue as measured with these EMG and motion analysis, so the fatigue in your muscle precedes the experience fatigue. So when you experience, listening to your body is okay, but know that you are already late when your body says to you that you are fatigued. This is a very complex figure. But what I want to show you, these are all these compensation mechanisms we measured in only 11 people. So in other words, every person has a different compensation mechanism. It differs per person based on the level of muscle strength per person. So therefore, the advice has to be personalized. And I always say in almost every presentation, one size doesn't fit all. I take a look at the patient in front of me. Who do I have in front of me? It's very important. Always at the end of our presentation, it's very important that I say something about aids, because as a rehabilitation physician, I always prescribe, for example, arm support, orthosis, orthopedic shoes, walking aids. And many patients are afraid that by using aids, their muscle become lazy. But we know that's not the case. In contrary, when you use aids in the right way, you are able to perform your activities for a longer time with less muscle fatigue. And we show that in boys with Duchenne, and that when they use their arm support, you can see that the lines at the lower side for the arm support are longer and not vertical. So they can move for a longer time with less fatigue. So use your aids in the right way and don't be afraid that you become lazy. I already said to you that it's difficult to measure your own muscle fatigue. So we as persons in daily life, we are walking and cycling without a dashboard. So what my aim is for the future is to develop a muscle watch, or a kind of a watch that helps you detecting your muscle fatigue. And we are finding a way to measure muscle fatigue in your whole body, because your muscles are over your whole body. And that we help you creating a dashboard for daily life to perform your daily life activities and your exercises. So keep in mind, when you are active, when you are starting exercise, start low and go slow to prevent muscle fatigue, to prevent overuse, to prevent compensation mechanisms, because these can lead to pain. That one size doesn't fit all. So ask your physician, ask your therapist for personalized advice. That context matters. Exercise is more than exercise alone. You also have to have a balance in your daily life activities, enough rest to improve from your exercise, and listen to your body, but listen proactively to your body. So I'm very curious to all your questions on these topics.
Thank you. My video. Here we go.
Yeah,
That
there
would
you
be
are.
lovely. I just needed my video to start. Thank you for your patience. We've got a lot of questions in the Q&A, and we will get to as many of them as we can. I think that we will be successful with the fact that we've got 30 minutes to go. Let me get here at the beginning. First up, and you may have answered this already in your presentation, but what is the difference between physiatrist and being treated by a physical therapist?
What a good question. Yeah, I mentioned it a bit. Um, the difference between a physiatrist and being treated by a physical therapist is that, of course, a physical therapist also takes the context into account, but a physiatrist is looking at you as a whole person, so also at the medical aspect. What medications do you use? What kind of myositis do you have? What's the severity of your disease? In the Netherlands, a physiatrist can also prescribe, for example, occupational therapy or psychological intervention. So my advice is to first visit a physiatrist when it's possible in the country you live in, that he or she prescribes exercise, and that you then go to a physical therapist, because a physical therapist is, as the name already implies, specialized in physical therapy and can help you developing a specific program. So, for example, the weight, the frequency of your strength training, or the duration of your aerobic exercise. So that's the ideal situation. First go to the physiatrist for the whole picture, and then to the physical therapist for the prescription of the medicine, exercise as medicine. Yeah.
And I would like to remind everyone to please put your questions in the Q&A box. We may not be able to get to any that are in the chat box. So if you could please take the time to put them in the Q&A box, and that also enables us to pull a Q&A report and have all the questions in one place. So thank you for that. Any effective therapy for finger flexor weakness and limited ranges of motions in fingers?
Yeah, thank you for that question. The limited range of motion in fingers is caused by weakness in the finger flexor muscles. Your fingers have, to be short, you have flexors that bend your fingers, and you have extensors of your fingers. And in myositis, especially in inclusion body myositis, most of the time the flexors are more weak. And then you can see that you are not able to bend your fingers anymore. Or sometimes it's the other way around. There's weakness of the extensors, and then you are not able to extend your fingers anymore. Prevention is key. It's important to move your fingers, to apply exercises during the day, and also take a look at how you use your hands and your fingers. The body is always looking at the most easy way to perform activities. For example, when it's difficult to bend your fingers, the body tries to pick something up with extended fingers. But as a consequence, you don't exercise your flexors in daily life. So take a look, how do I use my hand and fingers in daily life? and try to do it in the right way with the right coordination. But first, you have to consult your physiatrist or hand therapist, occupational therapist, to take a look at your muscle strength, because you have to move your muscles against gravity. So you have to have the whole range of motion to be able to move in that right way. But prevention is key. When you have enough strength, so you are able to move against gravity, please be active. Open your jars, for example, in the right way, because that's the right exercise, because you use your hands a lot behind the computer to open jars for your clothes. And if you do that the right way, you have the right exercise. And to have when you are prone to contractures, you can move your fingers yourself to prevent limited range of motion. But also a very personalized advice is the best. So visit your physician or your therapist to get the right prescription for you.
Okay, I spoke too soon because we now currently have 54 questions in the Q&A box. So we are definitely not going to get to all of them. And I am doing my best to take both pre-submitted questions and live questions. This particular person has been living with juvenile myositis for 50 years. What data has been documented on how this disease affects survivors over the decades as it pertains to their muscle strength, stamina, and rejuvenation?
Thank you for that question. Yeah, there is not a lot of data, but we know a little bit from research that, but be careful because it's cross-sectional data, so it's not longitudinal. We don't know what's the cause and the effect. That people who are able to be active, that the disease severity is less. But I'm very careful with saying this because of course, the prognosis and your disease severity. Please remember the figure I showed you regarding determinant of health. Only 10% is medical care, 30% is behavior, so exercise, lifestyle, 20% is genetics. So there's a lot that you don't have any influence on, but there's still some 30% on average, and that's about lifestyle. And we see in data that lifestyle can be effective. But especially in juvenile myositis, with a disease severity, it can be very difficult. So take a look at that figure to see what can I do regarding muscle strength, etc.
Do you believe blood flow resistance improves the benefit of exercise? I'm so sorry. They said blood flow resistance, but we know that to be restriction.
Yeah, and this is especially in people without myositis, there's a lot of research on, and it's very effective. But please be careful because in certain circumstances, it has a lot of side effects and adverse effects. So I think that we have to be careful with blood flow restriction in exercise. Because it also can have a lot of negative effects. And I would say, please let first take a look at research on this type of exercise in myositis before applying it in daily life.
Thank you. Speaking of research, is there any addressing diaphragm weakness due to IBM?
Yeah, we see in a lot of neuromuscular diseases, also in myositis, that the diaphragm also has muscle weakness. The diaphragm is also a muscle, just like your biceps or your tricep muscle. And it helps in breathing, especially when you lie down in your bed, then the diaphragm is active. So when you experience dyspnea when you're lying down, then it can be due to diaphragm weakness. And we now frequently measure the pulmonary function in our patients. And we can measure, for example, your ventilatory capacity when you sit and when you lie down. And when there's a difference in your ventilatory capacity when you sit, when it's higher when you sit compared to when you lie down, that can be a sign of diaphragm weakness. And we know that some pulmonary exercises, like breathing in, breathing out, breathing in, but also exercise can help in this. But when you exercise, you already exercise your lung muscles. But there is an increasing amount of research which says that in a large group of people, diaphragm weakness is also a problem. And know that exercise helps in also building up strength in this muscle.
We've got a question, how do you handle stiffness? And I'm personally curious about that because in the running community, of course, we don't have myositis, but in the running community, everybody likes to say motion is lotion, meaning the more you move, the better you feel. And I'm just curious if that's true for people with myositis or if you need to handle stiffness differently.
Yeah, stiffness is a broad term. It can refer to stiffness, what I said before, that you are not able to move your muscles anymore against gravity. Then you have to be careful with strength training, because when I'm not able to lift my arm anymore, I will try to compensate, and then there's a high risk of pain. So I always say strength training only for the muscles in which you can move against gravity. But if you can exercise with your arm support device, then it's possible, because then you can lift your arm against gravity. Another thing that appeared to me last year was that when we're exercising, we produce lactate. Our muscles produce lactate as a waste product. And it's very important to apply a cooling down. A cooling down means exercising at a lower intensity than your exercise session. Why it's important? When we apply a cooling down, the lactate is moving away by the blood. Because when lactate builds up, it causes stiffness. When I, during a working day, I sit a lot in my chair. And when you are sitting, it's a very static position, then the same muscles are active the whole time. And then they build up lactate. And therefore, during static exercises or static activities like sitting, standing, you quickly build up lactate, and that causes stiffness. So what helps? Applying dynamic exercises, or when you sit a lot, try to move. And also after exercises, a cooling down. For example, exercising at a lower intensity, but also during daily life activities. For example, when you do the groceries, which is very a high level of intensity for you, yeah, maybe you can move a little bit after your groceries to make that the lactate goes away, because lactate causes stiffness. And you experience stiffness especially when you lie down or in rest. And then it can be a problem in your sleep quality. So it helps to apply cooling down after exercise and activity.
Have you seen any joint instability in myositis patients related to muscle imbalances?
Yeah, for sure. Muscle instability can be caused when one muscle is not able to stabilize the joint, or when the ligaments are not strict enough. And that's called hypermobility syndrome. And that can also be a problem in general, but also in myositis. But therefore, in exercises, it's good to have a look at your, with a difficult medical word, your agonist and your antagonists. For example, there are pairs of muscles. The biceps and the triceps are pairs of muscle. They regulate the movement around the elbow. So when I only exercise my elbows, it can cause stability problems or also pain, even pain in the elbow muscle. There has to be a certain stability, a certain balance between these pairs of muscle. So if you take that into account, and also take a look at the coordination of movement, physical therapists can help you with that, preventing compensation that can help in stability.
we have a couple of questions that are somewhat related. One wanted to know, is there harm in too much exercise? And then also, um, can I exercise my way into a flare?
Yeah, good question. We don't have the answer to the last question in research, but it's most of the time the exercise itself is not a problem, unless the intensity is too high, but it's the amount of rest. And it's not that your muscles are becoming more damaged, but the problem is that you can experience pain by overuse, what I showed you by compensation or by buildup of lactate. And when you experience pain, exercising and being active is more difficult. So then you are captured in a vicious circle. So don't be afraid that your muscles are damaged. But you have to be careful to apply enough rest after your exercises. And it's not possible, unfortunately, to give a personal advice because no one is the same. But talk to your physician or therapist. How can I apply enough exercise in order to prevent pain from, or how can I apply enough rest to prevent pain from exercise? That's very important.
Can
And
muscle
also, if
loss?
you are too fatigued, then you can be more prone, and when you experience pain, to flares. So I don't know. Have an answer regarding research result on this, but my clinical experience is that you have to be careful. There is a certain amount that you have to be active and exercise, but there's also an upper level that you have to prevent overuse.
Can lymphedema be part of myositis, and can it be helped with physiatry?
Um, yeah, that's also an indirect symptom most of the time because it appears when you're moving, your muscles are a bit of a pump and they pull away the edema from your lower leg muscles to the blood and to your heart. And when you, for example, you're sitting more or sitting in a wheelchair or not able to move or exercise or being active, then lymphedema can appear. And exercise and being active can also help in preventing that. But sometimes the compression socks are needed to help in that.
Right, there are a lot of moving parts. I do apologize. Um, Someone wants to know if this is being recorded and when it will be available. It will be on our YouTube channel at the beginning of next month. So look for that.
Yeah, and I promise when some questions cannot be answered during this webinar, I will answer them.
Oh, thank you. That is
Yeah,
so nice
yeah,
of you to do. I really
yeah.
appreciate that. Okay, I'm sure we all feel better now because we've got 15 minutes left, and I will pull the report and send that over to you because there are just so many wonderful questions. Um, I'm just going through the ones that seem to be more related to different things. How soon after diagnosis is it reasonable for patients to start or resume exercising? This came up a couple of times because someone else was like, I've just been diagnosed and I don't know, should I just jump in or should I be resting and healing first? So thank you for answering that.
Yeah. Thank you for that question. Yeah, and also for people who don't have myositis, it's good to exercise and be active. So um, it is possible to exercise and being active soon after diagnosis. And remember my advice, when possible, visit a physiatrist, neurologist, and afterwards a physical therapist for personal advice. During flares, there's also a frequent question what to do. Then your muscle, there is inflammation in your muscle, and your muscle is more, how do I say, your muscle has less strength. And you have to be very careful with exercise and activity, but you can still be active, but you have to lower the level of intensity. But most of the time you are feeling ill or you are having medication, so there is less time left for exercise. And don't be afraid that in such period when you are not exercising, that it's negative, because after the flare you can build up your exercise again at a lower intensity. So don't start at the same intensity as before the flare, but start low and go slow. But being active is possible because your muscle will heal, but apply more rest and lower the level of intensity.
Does physiatry take arthritis into relationship with dermatomyositis?
Yeah, in the Netherlands, the arthritis is being treated by the rheumatologist, but we do have a lot of contact regarding the treatment. So in the Netherlands, a physiatrist doesn't treat the arthritis, but of course, we do take it into account in our prescriptions. So in the Netherlands, a lot of myositis patients visit the rheumatologist and the physiatrist.
What is the difference between stiffness and rigidity?
Oh, that's a good question. And rigidity, is there, can you explain? I don't know the.
Yes, that might be a language.
Rigidity. I'm sorry. Yeah, I think that, yeah, it's good to know, because sometimes people say stiffness when it's rigidity, or the other way around. So it's good to know or to ask your physician, is it the buildup of, and yeah, I think there you have to make a difference between, is it there the whole day long or every time, or is it fluctuating? When it's fluctuating, it's most of the time because of the buildup of lactate. And when it's there all day long and always the same, then it's having to do with your muscle strength. And the treatment is different. When it's fluctuating, you have to take into account more cooling down, more frequent rest, and more dynamic movement instead of static movement. And when it's there all day long, then you can take a look, for example, at dynamic stretching. But be careful, because dynamic stretching can also be unhelpful for your muscles. So in that case, please consult your physician or therapist to get the right exercises. I also saw a question on static stretching, but static stretching can also have negative effects. So be careful with stretching. So take a look, is it there all day long continuously, or is it fluctuating? And if it's fluctuating, it's more related to as a kind of a negative effect of exercise.
There is no physiatrist available in my community. I would have to drive a couple hours away, and no PT of in my area has heard of myositis. Do you have recommendations?
Yeah. When we share some information and the answers on questions after this webinar, I can also send you my website. There's a lot of information on exercise on that website. Because there was another question on what's the right physical therapist for me. In the Netherlands, we have a care network project, and we say the right physical therapist is the one who is curious to you as a person and who is able to read information on myositis, because also in the Netherlands, a lot of physical therapists in the neighborhood don't see any myositis patients or don't have any expertise, but they read about myositis, so they learn about myositis, and then they learn you as a person, and then they match these things together. That's the right person you need. So when there's no physiatrist, maybe there's a physical therapist or a personal coach. You need a person who is curious to you as a person, who you are, what you like, what's your aim, and to read about myositis and the general advices to prescribe a program for you.
A lot of our members were very active before this diagnosis, some of them athletes, and we've got a question about should you feel the burn when you're exercising? I mean, a lot of times when you start weight building as a person without the chronic illness, they say no pain, no gain. You want to feel the burn. And I know you talked a little bit about not overdoing it, but I wanted to ask that specific question about the burn.
Yeah, no pain, no gain is not true. It's a very good question. In top sport, many top sporters now apply polarized training. And what is polarized training? That means that 90% of the time you are exercising at a low intensity with no pain. And 10% of the time they exercise at a higher intensity. And why do top sporters perform polarized training? Just as you, to prevent pain, to prevent overuse. So it's not true, no pain, no gain. When you don't experience any pain during your exercises, it's okay. Sometimes you do feel some muscle pain, but that's okay too. But I always say that muscle pain has to go away the same day. So you don't have to experience muscle pain the day after. It can happen now and then, but please not more than once a week, because when you experience that more than once a week, your exercise intensity is too high. So to summarize, no pain, no gain is not true, because you can exercise without muscle pain or muscle fatigue. But in the other words, when you experience pain or fatigue during exercise, it's not a problem, but it has to go away in 24 hours. Otherwise, your intensity is too high or your amount of rest is too low.
We've had a couple of weight loss questions. One was worried about losing weight, and another would like to lose weight for behavioral change and wants to know your opinion on weight loss drugs like Ozempic.
Yeah, interesting questions. The first one, when you are afraid of losing weight, when it's possible, it's also good to have nutritional advice. But you don't have to use supplements or a lot of protein when exercising. When you have a healthy diet, then it's okay. But sometimes you are not able to chew or you have swallowing problems, and then it's good to have advice of a dietitian to take a look. Do I have enough protein? There's one main advice. We know that when you're exercising or being active, and you have protein, for example, with yogurt or milk afterwards, then your body uses that protein a lot. And also in the evening. So for example, after dinner, have some protein in yogurt. That's very better to take protein in your yogurt in the evening than during breakfast and or after exercise. So be careful when you have a normal diet, there's no problem when you're exercising. When you think that you have limited proteins, for example, ask a dietitian. Also when you have a vegan diet, for example. The other one, how to lose weight. Start low, go slow. It's very effective in losing weight, because when you're exercising at a low intensity, then you burn more fat relatively than when you are exercising at a high intensity. In the measurements we performed, it appeared that a lot of patients exercise at a too high intensity, and as a consequence, the amount of time in which they burn fat was very, very limited. Therefore, the exercise only leads to a lot of fatigue, but not to lose weight. So when you exercise at a low intensity, you don't have a lot of pain, it's safe, and you lose weight. So start low and go slow. And there was the Ozempic, yeah.
Yes,
Yeah.
the Ozempic.
Yeah, and that's of course different per country, if it's prescribed or not. And there can be also side effects on the intestines, or on the stomach or the liver. So be careful with Ozempic. And first take a look, can exercise help me in losing weight? And be careful to gain weight, because every a pound that you have with you, it makes the movement more difficult. But of course, I know that it's difficult to being active, and with that, it's also difficult to not gain weight.
We have time for one last question, and I want to ask this one because it really can affect your quality of life when you have issues being regular. So, are there any exercise that can kind of help with indigestion so that things move through your body more? Let me see. I now have 68 questions, even though I just keep getting more questions, so I've got to find that exact one. But yeah, apparently they're having a hard time going to the bathroom, and they're wondering if there's anything that they can do to help with that, outside, of course, diet and fiber and things.
Yeah, and don't forget the water, to drink enough
The
water.
water.
Yeah, because that's most of the time a problem, because you don't want to go to the toilet too frequently, or have problems with swallowing. So a lot of patients, please take a look at your water intake. And also a good one, being active and exercise can help with that problem, with constipation. Um, Walking and swimming are very effective in that, but also be careful, because when you're active, the blood goes to your muscles and not to your intestines. So also take a look, for example, drinking and eating before and after your exercises. There are several advices for people without myositis regarding what to eat before and after exercises, and that applies when you take your, for example, swallowing problems into account, also for you. So every movement helps in preventing constipation. And in my clinical experience, especially walking when possible and swimming are very effective in that.
Thank you so much. And I'm so sorry to say that is all the time we have for today. Thank you so much for the critical work you do for the myositis community across the world. We appreciate you. Thank you especially for being willing to take more time out of your schedule to answer the questions, which I will send to you shortly. I'm also going to, in a follow-up email as soon as I can, send everyone the slides, and it will have the links. We've put several links in the chat. So if you missed those, you will be getting those as well. We would love to see you at a future support or affinity group meeting. You can find that information on our website. And we also are so excited to invite you to a very special presentation, Congressional Outlook 2025, Medicare and Medicaid for the Myositis Community, hosted by TMA's Women with IBM Affinity Group. That will be April 15th at noon. You can register on the website, and we also put in the chat our next Ask the Expert is an immunology edition with Dr. Yves Allenbach, and you can also register for that and more. And don't forget, not very long from now, it's going to be Myositis Awareness Month, and just keep an eye on your inbox because it probably will explode from all the things TMA is doing. So thank you again, Dr. Voet, and until next time, I wish you all joy.
Thank you very much, and I'm happy to join at another webinar. Maybe the questions lead to another important topic for another webinar. So happy to work with you.
Oh, for sure. We can do an encore probably anytime. So,
Yeah.
all right. Thank you, everyone.